Good afternoon. Welcome to the Foundation's briefing on population change, equity, and well-being. I'm Christina Ciociola, Senior Vice President for Grantmaking and Strategy at the Foundation. We're going to go over some housekeeping items first, and then we will get to the main event. So all participants are muted, and we can't see you, and you can't hear or see each other either. Closed captioning is on. If you want to turn it off, select the CC button on the bottom of your screen. If you're having any kind of technical difficulties, please contact us in the chat using the chat feature. And please submit questions for the panel using the Q&A feature. Please try to avoid submitting your questions through the chat because then it becomes difficult to navigate the questions back and forth between the chat and the Q&A feature. We will also be using the raise your hand feature if you want to share reaction to the data, but I will talk more about that in a few minutes. So today we are very pleased to be joined by DataHaven's Mark Abraham and Kelly Davila. The foundation has been supporting and relying on DataHaven really since its inception to inform our work and the work of the nonprofit sector and as well as government. DataHaven continues to be an important hub for data and information on our region, and its work has expanded to cover the state of Connecticut with its Wellbeing Survey and its recent release of its equity reports. Today, we're going to look at an early snapshot of data from two sources, the most recent census, as well as the Wellbeing Survey, which is still going on. We will also get an introduction to one of DataHaven's newest and I think most exciting resources, its newly released town level equity reports. This is going to be more of a high level overview of some key findings and topics. In the coming months and next year, we'll have the opportunity to dig deeper into some of these topics and data, particularly as the foundation releases its community progress report later next year. We will take some breaks in between the topics to address questions and reactions. Again, use the QA feature to enter your questions. I'm also going to give you the opportunity to share your reactions. If you want, you can raise your hand. I know we have many nonprofit executives and staff on the call, and it would be great to hear some of your reactions to the data and information, and if it aligns with what your experience is on the front line as you do your work. We are expecting over 100 people to join us this afternoon, so I may not get to everyone's questions or reactions, but we will do our best. With that said, I am going to pass it off to Mark and Kelly. Thank you, Mark and Kelly. Welcome.
Thanks. So I'll go ahead and kick it off. Like Christina mentioned, we're just going to cover a couple of different sources. The most recent census, that data came out in August of this year. It's pretty limited. It only contains information on population and housing, but we've done some analysis of that information so far to just kind of get a sense of how this data has changed over the past 10 years. Then we'll cover some information from our Community Wellbeing Survey. The survey is still ongoing, but this data is going to cover through August of this year. And then we'll finish up with town equity reports. So first we'll start with the census and then take some questions about that before we move on to the next couple of topics. So updates from the census. Within the region, the 13-town region, only 2 towns saw any measurable growth. To compare this to the state, Connecticut saw only 1% population growth. So this is pretty much in line with that, but does kind of track with the notion that like Connecticut's largest cities have grown the most, to the exception being Hartford, which lost population. But for example, Stamford is now the 2nd largest city in Connecticut when previously that was New Haven. So within the region, we see a lot of population loss, especially in the more suburban areas and more growth in the denser kind of urban areas. Of these several towns, housing kind of tracks with the population growth that we see. So there were about 5,200 new units developed, or new housing units in the greater New Haven area, the 13-town region, but most of those, half of those, were in New Haven alone, and the majority were in just a few towns. East Haven notably lost, a significant number of units, more than 100 units. Again, kind of comparing that to Connecticut, Connecticut overall gained 3% of housing units. So I think that's about 60,000 units. And most of those, again, were in the largest cities in Connecticut. The census information also includes population by race and age. So what we're seeing is that New Haven among the region remains the most racially and ethnically diverse. So there is some change since 2010, but for the most part, the town has really seen kind of a 30-30-30 split among the three largest racial and ethnic groups. Connecticut overall is the fourth in this slide. So what we're seeing is, there are 3 towns in the region that are more diverse than the state overall, and the rest are considerably less diverse. But what we can see is that among children, racial and ethnic diversity has increased, not just in New Haven, but in many other towns in the region. And that's true of the state overall. As populations, in the past 10 years, there's been more of a trend towards populations describing themselves as more racially and ethnically diverse than they have previously. And then children tend to be more often 2 races, or we'll list a Latino ethnicity alongside another race category. So we included some analysis of neighborhoods. The census information gives us really detailed information down to what's called the census block level. And that allows us to do some analysis like what I just presented at the neighborhood level, or a very small geographic level within a town. So we've got some of those available on our website. We'll share the slides so you can have this link, but it's also available like on the splash page of our website. So with that, before we go on to the Community Wellbeing Index, we can take some questions on the census information.
Thanks, Kelly. So I have a couple of questions. You talked about the diversity and demographics of different parts of the region. Are any parts of the region becoming notably more diverse or less diverse compared to previous years?
Again, the large cities in Connecticut are becoming more diverse, but they were previously fairly diverse. The exception, I think, being Stamford is the only majority white of the large cities in Connecticut. At the neighborhood level, we see increasing diversity that kind of tracks along with their cities. In the New Haven area, there's some notable diversity in neighborhoods that were already previously pretty diverse too.
Yeah, a couple examples of that would be, like, if you look at downtown New Haven and areas right around downtown, there's a much greater Asian American population. So actually a lot of New Haven's population growth you could attribute to more Asian Americans. And then in some neighborhoods like New Hallville, which actually saw big population growth, that was all driven by a large increase in the Latino population. So previously New Hallville was heavily African American. It's now more of a mix. So we see that trend in some neighborhoods as well.
And could you say a little bit more about population loss? How do you measure that, and what does that indicate in this data? Are people just migrating around the state to different locations, or are they leaving the state altogether?
That's more challenging to say given the information, because this data is just a head count. So it's difficult to know if people are just moving from one town to another, or if that's what's considered kind of like natural growth, which is births versus deaths. But within the region, I think we can see that there's where more housing is being built, for example, you're just seeing more population growth in those areas too.
And to that point, with the housing stock changes, especially in New Haven, what kind of housing stock, I think I could guess the answer to this question, but what kind of housing stock caused the growth in New Haven specifically? Is it more affordable housing? Is it less affordable housing?
Yeah, I think over the past several years, so I've only lived in New Haven for a couple of years, so I'll let Mark kind of chime in on this too, but definitely downtown, what you see is more market rate housing being built and less, affordable housing. Affordable housing is challenging because you're always asking the question, affordable to whom, or do you mean subsidized housing, which is kind of a different story altogether. But in the neighborhoods that saw the most growth, like downtown New Haven, that's going to be all, market rate housing. As people can see, just kind of like driving around or walking around downtown, the apartments going up are typically more market rate.
Yeah, another interesting factor with housing is some housing units were vacant. So in some neighborhoods like New Hallville, there was almost a 20% vacancy rate in the last census, and now it's about 11%, which one of the things I was surprised by was to see that. So even though the number of housing units might be the same, those sort of vacant homes may have been renovated or filled with families, and that could lead to, that seems to be what's leading to population growth in some areas also.
And someone in the chat Q&A is asking about East Haven specifically and the housing or population loss there.
Yeah, presumably there must have been some kind of complex that was torn down. Again, I haven't lived here for very long, so I'm not sure what went down there, but that's a kind of the, the assumption that I would have.
And then we have someone else asking about, can we discuss what may have been a big population inflow due to COVID-19 and how much of the census data captures COVID-19 impacts? I think there's a sense that people were fleeing maybe from the larger cities to different parts of Connecticut.
Yeah, we did see some of that data captured. There was certain areas like close to New York City did see several thousand additional residents move in, but we didn't see that as much. For most of the sources we reviewed, the impacts weren't as significant. We know that like right during the first part of the pandemic, people moved in back with their parents, so we saw some population here, but at least it seems like those would have been people like in college or right out of college, and they have tended to move back to where they were before.
So someone is also saying in the Q&A specifically about East Haven, they feel like maybe the census was underreported in East Haven. And I think that raises a larger question. I know the foundation supported, and there were a lot of efforts to get out the count and to really ramp up the census count. Can you say a little bit about how, are we happy with the census turnout and the count? Do we feel like there was undercounting? What's the consensus about that?
In terms of the overall trend, like when we saw population growth in New Haven, for example, that seemed to track or be better than what the previous estimates had been prior to the pandemic. So it didn't seem like there was a large undercount, like a dramatic undercount, but there is research now showing, like in previous censuses, some groups face more of an undercount. And that's something that the census is continuing to explore. Unfortunately, some of their programs to explore what the undercount is are significantly delayed. So we won't really know. They're having some trouble measuring the undercount just because so much of the work at the census has been delayed over the past few years. So that's something that they're still trying to answer. But generally it is true, like there are groups like young children who are undercounted in most censuses. And we'd be surprised if that wasn't the case this year. It does seem like the city did a good job adding new housing units, for example, to know where those units were, so people were counted, and also making sure that college students were counted, even though some of them may have gone home or temporarily due to the pandemic, they were still counted. Like at their usual place of residence was still, the Yale dorms or the Southern Connecticut dorms, even though some of them may have been at home at that time.
Great, thank you. Okay, let's move on to the next section about the well-being survey.
Okay, so again, the well-being survey is underway. This is just data from through August of this year. This is the 5th wave of the survey. The survey itself, as many of you may know, is just designed with the input of lots of different people, lots of different advisory members, and different funders. And we've asked questions in the past on demographics and well-being. We've added questions this time around on incarceration. Things like gun violence are included too, trust in specific institutions of government. And then we had a COVID panel last year, which was really brief, just a couple of week window that allowed us to kind of see the impact of how people might have been responding to different economic and health related issues surrounding COVID. So we're hoping that a data release is coming out in October, and we'll kind of be presenting that information throughout the fall and winter. But the interviews, like I said, are ongoing throughout 2021. So this data that we're going to summarize today includes about 5,100 interviewers. Callers are, holding interviews in English and Spanish with some random digit dialing for both landlines and cell phones. So we weighted these to create a little bit more reliable estimate. But the one caveat is that because this is an ongoing survey, this is going to summarize primarily state level data, not necessarily related to Greater New Haven or New Haven specifically. So I'll cover a basic needs section, and then Mark will jump in with the well-being. So what we see here, this is August 2021 data, is that financial security, food insecurity, and housing insecurity tends to affect Black, Latino, and low-income adults most. This is pretty consistent with what we've seen in prior years, but we are able to look at some trends over time, showing that financial insecurity and food insecurity specifically, especially during the pandemic, kind of spiked for some groups and then fell back to kind of pre-pandemic levels. Notably, financial insecurity spiked pretty much only for Black populations, but that rate, this third dot on these plots represents 2020 data from our COVID panel. So this is kind of looking at just a snapshot of how people were the pandemic during, I want to say, June and July of last year. But many of these rates have dropped down to kind of pre-pandemic levels. This may be due in part to the effective stimulus money, and then also just the expansion of different social service programs over the past couple of years in response to the pandemic. But although those programs have obviously proved helpful, there's pretty large inequity gaps that are still apparent in different measures of basic needs and financial and food insecurity, notably. Underemployment is another metric that we track, and that is defined as the number of people who are looking for work, who are out of a job, not necessarily looking for work. That's one distinction between how we ask the question and how the census asks the question. So people who are out of work, and then people who are working but want to work more hours. So underemployment spiked pretty significantly last summer, but has since dropped down to pre-pandemic levels. But again, what we see here is that there's pretty large inequity gaps remain, and in some cases are larger than they were before the pandemic, as things kind of begin to get back to normal in terms of employment. I'm sure many of y'all have been reading headlines that just the current landscape of employment is a little bit different than what it has been in the past. So it's difficult to interpret this without thinking about how people are kind of perceiving the workforce now and their willingness to want to work more hours or take jobs that could be risky to them and their families. So we'll take some questions, or sorry, I'll just pass it to Mark and we can take questions on Community Wellbeing Survey after that.
Thanks, Kelly. So in terms of the pandemic impact, we know that the impacts have been very disparate, and along lines of our survey, we ask residents who take the survey whether they work from home, for example, or do they go out, do they leave their home to go to work? So when we break down any of this data from the Wellbeing Survey by, for example, whether you work from home, there's often vast differences in terms of people's perceived risk levels, their concerns about COVID, and then financial issues as well. So I'll just run through a few of these, but you might start by looking at the chart on the bottom of the slide. And it shows when we ask the question about whether people are better off financially during the pandemic, for adults in Connecticut earning $200,000 a year, about half say they're actually better off financially during the pandemic. About half say they're about the same as they were before, and only 7% say that they're worse off. Whereas for adults in the low-income categories, it's much more mixed, and many report that they're worse off financially, including middle-class adults. Many of them report finances have gotten worse. There could be reasons for this, including job loss. So now if you look at the top of the slide, you can see many adults lost household members or close friends during the pandemic, about 17% of the state. And then a good share of adults actually had COVID or had severe symptoms from COVID. So in some cases, those are persistent. About a quarter of the state lost a job in the past year, including 37% of adults who identify as Latino or Latina. So that's, obviously those impacts were felt and affect, many of the other issues we measure in the survey around well-being, like people's life satisfaction, happiness, ability to participate in community. There are some areas too we measured, like food pantry use, and you can see in the point here, about 12% of adults receive meals from a food pantry, including a larger share of adults living in city centers. And one thing we noticed that's interesting in the survey, in addition to sort of differences by income or employment status, we do see some differences by age, which I think are currently in discussion in TV, radio programs. But there are we do notice like higher levels of anxiety among young adults, and also most people think that jobs are like plentiful in Connecticut, or that that perception that good jobs are available has increased since before the pandemic. But for young adults, that's not really true. They still feel like there's not really good jobs out there. And partly that's the perception of like, why would you want a job? It's sort of an opportunity for advancement, for career development, and a young adult might look at that differently as compared to a middle-aged or older adult. One of the good news that comes out of the survey, and this is similar to the 2020 data we collected, was that there's a high level of trust in institutions in the state. So that would include local health officials and hospitals. About 90% of the population reports a great deal or a fair amount of trust in health officials and hospitals. Even within that group, though, we see, especially in the urban centers, there are some adults, particularly younger adults, who don't trust healthcare systems. And we'll talk a bit about that later, but you could see one of the areas where there's more of a gap in trust also would be trust in local police departments. So it's about 70% trusting their police department in the city centers, or what we call the urban core, and about 90% in suburbs in the state. So kind of a large difference in trust in the police. The other areas have, are important to understanding the pandemic, because often like there's lower levels of trust in the federal government. It's just more of a distant kind of institution, higher levels of trust in a local government, like your mayor or your town elected officials. And that's important to understand in kind of, responses to the pandemic, the need for local actors to disseminate information on science and federal policy to their constituents. And one of the things the survey measures this year is vaccination rates. In the last survey in 2020, we measured that as well. But now we have more data on that topic. So this slide shows you like basically across demographic groups in the state, there are fairly high levels of vaccination relative to the nation as a whole. As we know, Connecticut, I believe, is, it's either number 1 or number 2 on vaccinations now. But this chart also shows kind of people who are not vaccinated. So say, for the other 7% of seniors, for example, how many will definitely not get the vaccine? It's only 3% of seniors or older adults who say they definitely won't get the vaccine. And then there are shares that say they're trying to get it as soon as they can still. They're waiting to see what the effects are, or they'll get it if like it's mandated. And what's interesting is how these the shares of these reasons vary. We also asked like specific reasons about what people are concerned about. So in some cases, especially for people who are working, there's a lot of concern about missing work. So someone who says that they're worried about missing work because of the side effects of the vaccine, or just not being able to take off time from work, they're more likely to say that they're sort of going to get the vaccine as soon as they can. They just maybe haven't had time for it, so they haven't necessarily prioritized that as an issue. Whereas for other folks, there are other reasons for that. And there still is, there's a large gap, as we know, from between racial and ethnic groups in the state, as well as, in the longer press release, we discussed some of the other differences. So I'll get into those here. You can see many of the differences are much larger if you sort of look beyond demographic differences, but into kind of political affiliation or life experiences. So the one we've heard a lot about is the differences between Democrats and Republicans. So very few Democrats are definitely not going to get the vaccine. whereas 13% of adults who are Republican are saying that they definitely won't get the vaccine no matter what. And then these other life experiences are very predictive of vaccine intent as well, or vaccine refusal. People who've had family members incarcerated, who are finding it very difficult to get by, who don't get support from their friends and family, are much less likely to get to have gotten the vaccine. And in particular, residents who don't trust their healthcare systems or don't trust the federal government. And those could be completely different groups of people, like demographically, but for residents who don't, like I mentioned, the urban city center residents who don't trust their local hospital, they're 23% of that group says they're not going to get the vaccine no matter what. So these are important issues if we think about kind of how to increase vaccine uptake, both of COVID vaccine and also other healthcare types of healthcare like flu vaccines and just primary care. These are important factors to consider kind of beyond the demographics. There's some interesting data from a survey about mask wearing. You can see generally that 81% of residents were wearing masks in 2020, and that's now dropped to about 52% wearing them very often. So it's dropped, but it's still higher than it is in most of the United States. The most interesting thing we saw in this chart was kind of the gender disparity. So the rate dropped for women, but the rate dropped much more for among men. So in this case, you can see at the very bottom of the chart, the percent of men wearing masks very often, it dropped from 76% to 39%. And the other thing about this, it does show, groups that are represented in jobs like service industry or healthcare industry are more likely to be continuing to wear masks. The survey, there's a really large, if you're not familiar with the survey, you can download it on our website, but there's a really wide range of questions in this interview. One of the questions we added this year was around experiences with gun violence. And we just asked this question in the 5 largest cities, but it was a bit surprising to see, that within the past year, 12% of adults in New Haven have witnessed a shooting, which is much higher than it would normally be in most of the state. You can see sort of Stanford, Connecticut is more similar in terms of income and prosperity to like the rest of the state, and you can see there's less than 1% of adults witnessing a shooting. So this sort of stood out to us as an issue that it's another very high source of stress in people's lives in New Haven and similar communities. And briefly, I'll just discuss the town equity reports, then we'll take questions. The town equity reports are a resource that we released a few weeks ago. They're available for all 169 towns in the state. And if you're interested in the wellbeing survey data, for example, you can then get it through these town equity reports for some of the smaller towns, in some cases more easily than you could through the traditional kind of cross tabs that we released. The reason for that is we were able to combine data from different waves of the survey. So again, you could access it for sort of smaller groups. And the main reason we did this was to basically take raw data from that survey as well as census data, sort of micro data from the ACS and some of the other federal and state sources, and break it down for small communities and also for racial and ethnic groups in each town. So this is something that we don't think had been done previously. And we thought it was really important for each town in the state to have data by race ethnicity. That was one of the requests we often received was like, how are people doing in my town? But like not just the town average, how are people doing, based on what community they're a part of in that town. So these reports seek to answer that question. And these are just a few examples of the graphics in the reports. Again, they're available for each town. There's some 2020 census data in there, as you can see from the Hamden chart showing the change over time. And there's data like, for example, home ownership rates by age and race ethnicity that show differences in access to home ownership are important, to understand both by age, what age you are, but also by race and ethnicity in your town. So with that, I'll leave it for questions. Thank you.
Thank you, Mark, and thank you, Kelly. We have some questions in here, and I'm going to go back to this. We covered a lot in this short period of time. I'm going to go back to the information on basic needs, on the housing, on the food and financial stability and security. And I'm wondering, you said we're seeing an improvement. The well-being survey is actually showing people reporting an improvement there, although the disparity remains. And there's, as you speculated, the improvement could be the availability of resources, government resources, and actually philanthropic resources during the pandemic to address these issues. I know at the foundation, we spent the most we've ever spent on basic needs last year. So I worry that that data is going to put out a false sense of security, because we're anticipating that might actually change in the coming months and year. So are you going to be able to actually keep an eye on that or track that, whether it's through the well-being survey, the continuation of the well-being survey, or other sources?
Yeah, I think one of the challenges with these data is that, we're asking if at any point in the past year somebody has experienced various things. So a lot of these questions are not just like a point in time, how are you feeling right now? But in the past year, have you had trouble paying for food? In the past year, have you had trouble paying for housing? So we're kind of asking people to reflect in that way. And then also because there's a period of time between the survey question being asked, that data being recorded, and then that data coming to us for analysis, and then us presenting this data to you, there's always going to be a little bit of a lag. So on the one hand, yes, we're not sure that these improvements are going to carry on throughout time. We're only going to ask these questions or conduct these interviews through later this year. So we're asking people to kind of reflect back on the previous 12 months between, say, October of this year, October of last year. In the future, I think that there's going to be some information out. There's lots of different people doing a lot of different polling and just survey questions kind of nationwide that might be able to get at whether or not these social service program improvements have really created a lasting impact, or if it's going to be short-lived. But I know that there's been some improvements. For example, like poverty among children has dropped significantly since the expansion of like child tax credit and just stimulus money overall. Whether or not that's going to stick throughout the next 3, 4, 5 years, we don't really know. But for the time being, I think that's that impact has been measurable.
Right, thank you. So I'm going to read some of these questions in the chat, and we're having some technical difficulties. So if you lose me, then please continue. You can see the questions in the chat. Understanding the difficulties in having more languages as part of the survey process, we know there are a lot more languages used in Greater New Haven. So presumably those populations are left out of the data. Can you say more about the survey and the languages offered when you administer the survey?
Right. So yeah, the survey is conducted in English and Spanish. That covers the vast majority of folks, and the reason to not translate it is like the cost of translation, basically. So we have translated it in the past for like special settings, like for refugee centers in Arabic, for example. Like it is translated, but to field it in a way that where we're always having someone on the phone who can speak every language is cost prohibitive. So we think it's better to do like 5 more interviews in Spanish than 1 interview in Mandarin, for example. So it's just a trade-off there. We think that if someone, generally, if you look at the data and break it down by language, including the other data we've collected, like if someone is, financially struggling, their responses aren't necessarily different by like what language they speak at home. So, if we think, in terms of representing like income or education differences, it's important. But those other community factors are important. They're just, those populations are really like so much smaller than the Spanish and English speaking populations. It's hard to capture them without like a study like specific to that group that goes into those communities and has like a lot of additional services for the research.
Was there an inquiry around families with early learners, birth to 5, and the impact of childcare as an influencer on perceptions and the impacts?
So yeah, we don't ask specifically about like people's experiences with their young children. we do include that as a question in the survey, like whether there are young children in the household. So we can kind of break out, things like food insecurity and try to see how those may affect young children, but we don't have a more detailed questionnaire about like the 0 to 5 age group in our, this current survey. There are other surveys, that do try to measure those things.
Mark, do you ask the age of the children in the household or just if there are children?
Yeah, like if they're under 5 or if they're school age, basically, we'll ask that question.
So you could run that data with some of the other factors.
Right. Yeah. In some cases, we see a big difference between households with children and households without children. For example, food insecurity tends to be quite a bit higher in households that have children than households without children, which reflects, the sort of stress, I think, in finding food for a family.
So this next question, do you have numbers on people who have moved into the city or the area by their economic status? Some of those population growth and shrinkage numbers, do you have that information by the economic status of those individuals who have moved in or moved out, I guess is the question.
In the survey, I want to say that we asked if they've moved in the past year, and then we do have most everything broken out by, or most everything we can break out by different income groups. That's not presented in this data, but I don't see why we couldn't run that.
And then there's a question around the economic challenges. So is there any data or evidence that the economic challenges people are experiencing are being caused by the migration of more people, I guess, moving in?
So I don't think that our survey would necessarily get at whether or not an economic challenge or any kind of the insecurities that we talk about are being driven by different factors in their community. I think that, again, because what we're seeing is very in line with what other surveys nationwide or surveys in other metropolitan areas are saying, that we can kind of attribute that mostly to much of it can be attributed to COVID and kind of the economic impact of that, more so than kind of neighborhood level or social level impacts to an individual.
Yeah, one related point to that is there is a housing shortage. We released a report a few months ago with the Urban Institute on housing needs, and it does show like gaps in the number of units available. So in the sense of like, New Haven is adding jobs, for example, more than anywhere else in the state. There are a lot of folks who live in New Haven who may be retiring, but they're not necessarily like leaving New Haven once they retire. So there are more workers, more need for housing in the city and in the region. And if the number of units isn't keeping up with that, it does tend to increase like the cost of housing. So we do see in the survey like more, even though food insecurity has declined, when we ask about like struggle for paying for housing, that's increased over time. So it's something to keep in mind, like even though people may have support for food stamps and other federal programs, like the cost of housing is still increasing, partly due to shortage of new units, especially like, because New Haven's really the only place building new housing units. So there's not enough space in New Haven to build all the units that would be needed for the region. So I think that's a factor that's related.
So there's some questions about trust. When you ask people about their trust in local officials or the police, do you get any contextual information about what's driving those answers? Is it their feeling around public safety and crime, or is it their feeling around how they feel the government has responded to the pandemic? Can you make any assumptions about that?
Yeah, we can compare those answers with other questions in the survey. And we think of them more as like context for some of the other questions. So like, for example, the trust in vaccines If we look at how that compares, like I showed a slide comparing that to trust in the federal government, and you could see there's a very significant association there. But in terms of the deeper like exploration of issues around trust, there's some qualitative research that we've been following, or and some we've been doing, like where we do like a longer sort of semi-structured interview where we just ask more of an open-ended question, and that's the kind of information that is useful for understanding, like, well, what are the specific reasons why people don't trust a provider or another institution, and those can be very complex. One theme that for the populations who identify as Black in particular, one theme that constantly will emerge from those conversations is like distrust of institutions and kind of the legacy of discrimination for many decades that people have experienced, and how that creates barriers to trusting different types of institutions. So that type of data, we try to like capture it through our survey by asking sort of questions from different angles, like about police keeping your neighborhood safe versus do you trust police? And you could see if you break it down by racial lines, you could sort of surmise that there might be, the reasons for that might relate to some of the information we know from the qualitative interviews about why people don't trust the police or other institutions.
Someone's also saying here in the Q&A, which I think is a good point, that it would be interesting to ask about trust levels with utilities as well, because of the role in offering ratepayer funded subsidies for making home energy improvements that impact the healthiness of the home. And I think for other reasons too, it would be interesting to ask about the trust level with utilities. There is another question here about, is there a reason for not breaking out the data on Asian American residents? It looks like maybe they're grouped with other ethnic groups.
Yeah, we have broken out data for Asian in the town equity reports. You'll see data for Asian residents and for Native Americans to the extent we can break it out. But for the purposes of the presentation, we didn't include that group just to simplify the data, basically. But it is, there are some very large differences between Asian residents and other groups in the community. So it is important to include that, I think. Just, it's a decision we made to focus on like the three largest groups, basically, for this particular slides that we showed. But yeah, we're happy to, if you have questions about that group, afterwards you can email DataHaven and we can share the results for Asian residents. You'll also see it like in the town equity reports, again, like sort of Asian changes in the Asian population or other populations.
So does DataHaven work with area employers regarding presenting this survey data so the employers can use it to inform their planning regarding the talent pipeline, childcare availability, housing needs, and other things?
Yeah, well, for one thing, the reports that we've published, like especially the town equity reports, they've been very widely distributed through like town councils and mayor's offices and schools and elected officials, like people running for office, for example. So we're encouraged by that. We're seeing like a wider user base based around that. But we do rely on organizations like yours to help share the data. Like if you find something interesting, you can share it directly with employers or have them contact us, and we can most likely schedule presentations for that audience. But that's where we rely sort of on our partners to share the data in that way. And usually our focus is on like state agencies and mayor's offices and other nonprofits. So we would like to branch out a bit more if we could.
That's great. So you mentioned state agencies. I know that you presented this information to the governor's office, and particularly as it relates to the vaccination information. Do you think, is there a sense that the information about vaccination rates, while Connecticut's doing really well in terms of our vaccination rates overall, that any of the information you've learned or presented is going to change any of the state's approach to increasing vaccination rates, or is there a sense that we've kind of gotten to where, as far as we're going to get with the vaccination rates?
Yeah, I think the rates will continue to increase. The state's working to, support like outreach, to support, like there's basically areas that impede vaccine access. One is like feelings of trust, another is like the structural barriers, like being able to get to a site. So the state has like mobile vans, for example, and they're making vaccines available through workplaces. Others though would be like just social support, motivation for folks. Those are things that maybe we don't talk about as much, but kind of the friends and family approach. So supporting, messengers like within workplaces and family practices, I think could be helpful. There's a lot of people don't have like regular, we can see like in our data, we ask about medical home, which is like whether people have a regular healthcare provider. And many residents, especially younger families, they still don't have like a medical home. So that would be an area that the survey data would suggest to kind of focus on more over time.
Yeah, in addition to that too, I think just a lot of this data from our survey that we're presenting in these slides kind of came out before things like vaccine mandates had really taken off, and those have shown to be pretty effective. I think, today the City of New Haven reported that there's now 100% compliance with that, which is, impressive. And then the other employers who've done that, I think, have seen that there's, vaccine rates among their employees have gone up. So that's one really effective tool, it seems like. But then also, just the expansion of like community healthcare workers who are not necessarily doctors and nurses at hospitals and clinics, but people who can kind of connect an individual with those kind of professional health networks have been really useful in kind of getting people to trust or to accept the vaccine, or to kind of answer some questions about side effects or the cost. Obviously they're free, but there are a lot of people who seem to think that they can't afford the vaccine. So those have also proven to be effective.
So I'm wondering if you could each say, out of all the data you've been looking at lately, whether it's the census data or the town equity reports or some of the well-being survey results, if you could each share what you think, for you, what do you think was the most intriguing or maybe surprising, or was there something you were pleasantly surprised by as you look at this data? Mark, I'll ask you to go first.
Sure. I mean, one I was, I guess, most surprised by is the in the census data, like the drops in kind of housing vacancy and the increase in population in places like New Hallville. So if you just look at, I'm familiar with the past few censuses, also like 1990, 2000, there's just so much disinvestment in New Hallville and some of the neighborhoods like that, where like houses were abandoned, houses were being torn down, and people were leaving those neighborhoods. It is interesting to see that the population is growing so quickly in New Hallville, some of the other neighborhoods like that, and that the housing vacancy is so much lower. So it could be related to a better census count, like getting out the count and making sure everyone's counted. It could be that there's more, investment in kind of maintaining those properties and just more interest in living in the neighborhood. So that, to me, to see like many new residents in neighborhoods like that and more investment, it is that was at least surprising to me, just given what we know about the past few censuses and how that changed.
Great, thank you for sharing that. Kelly?
I think I was most surprised by the fact that we were kind of able to see in near real time, given the panels of the survey that we've done so far, just the impact of different financial stimulus and like the expansion of social service programs, how those do have a kind of stark and immediate effect on populations. And when those things go away, the numbers tend to drop too. So it's very rare that you get to see kind of policy impacts in real time like that. So it was cool to see that in our data.
And correct me if I'm wrong, but that's actually something unique in this data set, isn't it, for DataHaven? This is not something that other people have been able to measure, really. Is that right?
There are lots of different organizations that are asking kind of similar questions, be it nationwide, or like I know NPR has done very similar questions to what we've asked, and they've been putting that data out over the past week or two. But different pollsters kind of across the country and different organizations like DataHaven and other places have in other cities have been asking kind of the same questions. So it really is kind of a situational thing. I mean, I think that like now, given the fact that the pandemic has gone on as long as it has, and the ability for us to kind of see how things have changed over time, it's a kind of a rare opportunity to see that.
In the Q&A, there's a few comments about how great the town equity, the town level equity reports are. Could you share a little bit about how you hope those reports will be used, and how you hope residents will engage in those, using that data, or how give people advice on how they could use that data?
Yeah, like I said, we're always getting requests from mayors from many towns have like a anti-racism committee or inclusion committee or racism and public health working group, especially starting around 2020. We saw many more of those committees throughout the state and more effort in that. And so we were getting a lot of requests for, like I said, data broken down for towns like along those lines. And that was the main reason to create the reports in that way. So we hope they're useful. Just, we do know from like other research that often people like will understand there's some kind of racial disparity in the country, but they don't necessarily know that the magnitude is that large. And also they don't always think it applies to their town. So being able to have numbers, even though they're like not always the most, because we're breaking things down to towns and smaller groups, it's like sometimes about as granular as you can get at the moment, but it does give you like at least some reference number that you can use and show that there are disparities along like health, environment, home ownership that are cumulative, and being able to point to actual numbers, I think, is useful for residents working on those issues. So we've already seen, like I said, the equity reports have been very widely used just in the first few weeks they've been out.
That's great. Well, thank you both for sharing this information today, and I look forward to hearing more from DataHaven in the coming months and over the course of the next year as we dig deeper into some of this data and some of these issues. And thank you everyone on the webinar for joining us today. Please complete an evaluation survey, which you will receive. It helps us plan out future briefings and helps us improve each time. You will also be getting a follow-up email about this donor briefing, I believe with a recording and also with helpful links and the PowerPoint presentation. So be on the lookout for that. And also please be on the lookout for the other foundation events coming soon. We'll be having a donor appreciation event in November, and you should be receiving an invitation for that soon in early November. And we're planning another donor briefing for this year on women, the workforce, and job training. So be on the lookout for that as well. Thank you all again. And again, thank you, Mark and Kelly. This was great.
Thank you.
Thank you.